increasing of the amplitude. Nothing happens, for example, if the patient is very weak and will have this problem. So then, my suggestion in that case, and that you may know that please, because that may help you, is when you are not able to find the vase on the patient, you should give a massage on his heel lobes for a minute or two, and then you check again the vase, and then you will find the vase much better than before. This is something which is important because sometimes it happens. And of course, as I told this morning, there are some conditions in which it's difficult to find the vase, especially when you have a patient who is under beta blocker, for example. So at the first sight, it's quite difficult to find, but you find the changes. But you need to be trained. So as a matter of practice, you have to take the vase in all your patients, and then you will develop this sensitivity. I have a practical question for tomorrow morning. I was willing to know if anybody here was suffering from any painful condition and willing to be volunteer for the treatment. How many? Okay, 4, 5. Okay, so because we will need to have demonstrations. So
we will not need any patients from outside. There are plenty here.
So then we will do a practical demonstration tomorrow, and then you will see how we use the vase, how we can use this black and white detector if needed, and how to use the blue probe and the black probe. So that will be a kind of illustration of, a practical illustration of what you will have learned here. So for today, I think that at 4:30 we could have a stop and leave a space for questions, because I think you have many questions, and I will try to answer as much as I can to your questions. And for the time being, I mean, Dr. Kapoor has the word, so she will tell me when it is 4:30. But I suggest that we continue to explore the indications. So I will give some therapeutic protocols, and then you can note down that on these empty and this blank here plates you have, you can take your color pencils and draw it, and so then you will have that in mind when you have a patient that can help you. So I just remind here this display just before. I will come back to something quite important. That was the differentiation between acute pain problems and chronic pain. So that in case, for example, of acute knee problem, you will measure the knee point. Okay? And if it's an acute problem, usually it will be needled on the same side of the body. If it is an acute right knee problem, you will needle the knee point on the right here. If it's a chronic problem, that means a problem who is there for more than 6 months, then you will check with the black probe, and then you will see if it is on the left or on the right here. You have to needle. In acute pain, you don't have this problem. So imagine we have an acute knee pain, you will have to needle the knee point, and you can needle, of course, the innervation area of the knee, plus the edge point of the knee, and actually the area muscle point of the knee is the shin, which is the same point. And according to the psychological condition of patient, you may find points in prefrontal lobe or in hypothalamus. And of course, in pain, it is most of the cases we use this suprarenal gland point. It is there also in chronic pains. I have more developed the chronic pain points. So in chronic pains, as I told before, the edge points to the organs. Sometimes organ points, sometimes not. And then you will have this opening point, which is called callosum, because in chronic pain, what happens is that the information of pain is also going to the other half of the brain. So that's why we use this opening point, this corpus callosum area. We will use this suprarenal gland for this cortisol secretion, which is important. Thalamus muscle point, and of course reticular formation. And the master sensory point, plus muscle point of the area, and psychic point or emotional points, especially hypothalamus, and of course chronic pain can lead to depression, so we will have the points for mental depression. I remind also that there is this segmental innervation that you can find in all anatomical books that is useful to have in mind when you are going to treat, for example, a lung problem or an esophagus problem. Then you know to which kind of ganglion you have to look for to be more effective. The same happens when you have any pain occurring on the dermatomas of the body, and you can use also these paravertebral ganglions, and they are really, really effective in these conditions. So, to put it back again, to chronic areas, the areas to be explored in chronic pain will be the suprarenal, but in acute pain I also use them. This reticular formation, and tomorrow I will explain how and why the reticular formation is so important in auricular medicine and auriculotherapy. There is this thalamus muscle point, of course, this corpus callosum point, because of what we said before, and the master sensory